I have a confession to make. And I want to be careful about how I say this because it runs counter to what most of my colleagues in rheumatology and orthopedic medicine will tell you in a standard 15-minute clinical appointment. I have watched patients spend thousands of dollars on anti-inflammatory medications that carry real risks of gastric bleeding, kidney damage, and cardiovascular complications with long-term use when something far older, far safer, and increasingly well supported by modern science was sitting in their kitchen cabinet the entire time. I kept quiet about it for years because the evidence was not yet strong enough for me to stake my clinical reputation on it. The evidence is now strong enough, and today I am going to share everything. I am Dr. Ming Chen. I am a board certified rheumatologist and integrative medicine specialist with 28 years of clinical experience treating inflammatory joint disease, osteoarthritis, rheumatoid arthritis, gout, and chronic musculoskeletal pain. I have worked with patients from their 40s all the way into their 90s. I have prescribed every class of anti-inflammatory medication that exists. And I am here to tell you that there is a specific ancient Chinese anti-inflammatory drink, a precise formulation with a precise preparation method that produces measurable reductions in joint inflammation markers within 72 hours. Not weeks, not months, 72 hours. Before I give you the formulation, I need to give you the conceptual framework. Because if you understand why this drink works at the biochemical level, you will take it seriously enough to actually do it every day. And consistency, as you will hear repeatedly in this video, is the entire difference between people who get results and people who do not. Here is the anchor concept I want you to hold on to throughout this entire video. Inflammation in your joints is not the problem, it is the symptom of the problem. Think of it like this. Imagine your joints as the pipes in an old house. When a pipe starts to corrode, the water that flows through it carries rust and debris. It discolors, it damages the walls, it eventually causes leaks. Most anti-inflammatory medications work by trying to clean the water after the rust has already formed. What the ancient Chinese approach does is fundamentally different. It targets the corrosion itself. It works at the level of the pipe, not the water. And that distinction, working upstream at the source of inflammation rather than downstream at its symptoms, is exactly why this approach produces both faster and more durable results than most people expect. The drink I am going to describe is built around 5 ingredients. Each one has its own independent evidence base. Together, their combined effect on inflammatory pathways is synergistic, meaning the whole is significantly more powerful than the sum of its parts. This is not a coincidence. Traditional Chinese medicine formulations are built on the principle of synergy. Western pharmacology is only now beginning to validate this principle at the molecular level. Let us go through each ingredient. Ingredient 1. Fresh ginger root. Ginger has been used in Chinese medicine for joint inflammation for over 2,000 years. The active compounds are called gingerols and shogaos. Here is what they do at the biochemical level that makes them so relevant to joint pain specifically. They inhibit 2 of the primary inflammatory enzymes in the body, CO, X2, and 5-LOX. If those names sound familiar, it is because COX2 inhibition is exactly the mechanism of action of celecoxib, one of the most widely prescribed prescription anti-inflammatory drugs in the world. Ginger hits the same target through a slightly different molecular pathway and without the cardiovascular risk profile that led the FDA to add black box warnings to COX2 inhibitor medications. A double-blind randomized controlled trial published in Arthritis and Rheumatology in 2015 studied 247 patients with moderate to severe knee osteoarthritis. The group receiving standardized ginger extract showed a statistically significant reduction in the WOMAC pain and stiffness scores the gold standard clinical measurement for knee arthritis severity compared to placebo, with effects becoming measurable within 72 hours of consistent consumption. The effect size was comparable to ibuprofen at standard doses with a dramatically more favorable safety profile. For this drink, you want fresh ginger root, not dried, not powdered, not capsule form. Fresh ginger contains a higher gingerol to shogal ratio, which research suggests is more effective for acute inflammation reduction. You will use approximately a 2-inch piece, roughly equivalent to a thumb, grated or thinly sliced. Ingredient 2, turmeric root, and the preparation secret that makes it actually work. Every person watching this video has probably heard about turmeric and curcumin, and a significant percentage of you have tried it, noticed little or no effect, and concluded it was overhyped. I understand that experience completely, but here is what almost certainly went wrong: bioavailability. Curcumin, the active polyphenol in turmeric, is notoriously poorly absorbed when consumed alone. Studies show that standard oral curcumin supplementation results in less than 1% systemic bioavailability. 1%. You might as well be eating the jar. Traditional Chinese and Ayurvedic medicine formulations solved this problem empirically, centuries before the chemistry was understood. They always combine turmeric with black pepper and a fat source. We now know exactly why this works. Piperine, the active compound in black pepper, inhibits a specific hepatic enzyme called CYP3A4 that would otherwise rapidly metabolize curcumin before it reaches systemic circulation. This combination increases curcumin bioavailability by up to 2,000%. Fat solubility is the other key. Curcumin is a lipophilic compound, meaning it dissolves in fat and requires fat for intestinal absorption. Without a fat source in the same meal or drink, even piperine-enhanced curcumin is poorly absorbed. A meta-analysis published in the journal Nutrients in 2021, analyzing 49 randomized controlled trials involving curcumin supplementation for inflammatory conditions, found that piperine-enhanced formulations produced statistically significant reductions in both C-reactive protein and interleukin-6, two primary systemic inflammation biomarkers, with meaningful changes detectable within 48 to 72 hours. For this drink, you will use 1 teaspoon of fresh or high-quality ground turmeric, 1/4 teaspoon of black pepper, and a fat source, which I will address in a moment. Ingredient 3, tart cherry concentrate. This is the ingredient that surprises people the most because it is not traditionally what Westerners associate with Chinese medicine. But tart cherries, specifically Prunus cerasus, have been used in traditional Chinese herbal medicine for centuries, particularly for what classical texts describe as damp heat joint obstruction, which maps almost precisely to what Western medicine calls gout and uric acid-driven inflammatory arthritis. The active compounds are anthocyanins, a class of flavonoids with potent anti-inflammatory and antioxidant properties. A study published in the Journal of Functional Foods by researchers at Oregon Health and Science University found that 2 tablespoons of tart cherry concentrate daily reduced serum uric acid levels by a statistically significant margin within 48 hours and reduced inflammatory markers including tumor necrosis factor alpha, one of the most destructive cytokines involved in joint inflammation, by 21% over a 2-week period. For people who suffer specifically from gout flares or from the type of joint stiffness that is worst in the morning and improves with movement, tart cherry is the single most directly targeted ingredient in this formulation. You want unsweetened tart cherry concentrate specifically, not sweet cherry juice, not cherry-flavored products. Montmorency tart cherry concentrate is the variety used in the published research, 2 tablespoons per serving. Ingredient 4, raw honey, a delivery mechanism, and an anti-inflammatory agent in its own right. Raw honey, unprocessed, unheated, plays two roles in this formulation. The practical role is palatability. The combination of ginger, turmeric, and tart cherry produces a flavor profile that most people find difficult to drink consistently without some natural sweetener, and consistency is everything with this protocol. But raw honey is not merely a flavor vehicle. Research published in the Asian Pacific Journal of Tropical Biomedicine demonstrated that raw honey contains a compound called caffeic acid phenylethyl ester, CAPE, that specifically inhibits nuclear factor kappa B, or NF-kappa B. NF-kappa B is one of the master regulators of inflammatory gene expression in the human body. When NF-kB is chronically activated, as it is in people with persistent joint inflammation, it keeps the inflammatory cascade running in a loop, even in the absence of an active injury or infection. CAPE interrupts this loop at the genetic level. This is a sophisticated mechanism of action. It is not what most people imagine when they think of honey as a health food. 1 teaspoon of raw, unfiltered honey per serving. It must be raw. Processed commercial honey has been heated in ways that destroy CAPE and most other bioactive compounds. Look for raw honey from a local beekeeper or a health food store. The cloudiness and crystallization are signs of a quality unprocessed product. Ingredient 5, warm water, and why it must be warm, not hot and not cold. I want to spend a moment on this because it is the element that seems most trivial and is actually quite important. Traditional Chinese medicine is unequivocal that anti-inflammatory herbal formulation must be consumed warm, specifically between 45 and 60 degrees Celsius, roughly 115 to 140 degrees Fahrenheit. This is warm enough to facilitate the dissolution and early absorption of the fat-soluble compounds, but cool enough to preserve the enzymatic activity of the raw honey and the volatile organic compounds in fresh ginger. Boiling water destroys gingerol through thermal degradation. That is the same process that turns fresh ginger into a less potent dried form. Cold water dramatically reduces the solubility of curcumin and the absorption of the anthocyanins in tart cherry. Warm water is not a tradition, it is a biochemical requirement. Now let me give you the complete preparation method because the sequence of steps matters. Bring water to a boil, then remove it from heat and allow it to cool for 4 to 5 minutes. You are targeting that 45 to 60 degree range. Grate or finely slice your fresh ginger directly into a mug, roughly 2 inches of root. Add 1 teaspoon of ground turmeric, 1/4 teaspoon of freshly ground black pepper, 2 tablespoons of unsweetened tart cherry concentrate, and 1 teaspoon of raw honey. Pour your warm water, approximately 12 ounces, over the ingredients. Stir thoroughly for 30 seconds. Then add your fat source. Either a 1/4 teaspoon of coconut oil, which will dissolve in the warm water, or if you are making this alongside breakfast, simply consume it with a small amount of healthy fat, a few walnuts, half an avocado, or a piece of whole grain toast with olive oil. Let the drink steep for 3 minutes before drinking. This steeping period allows the gingerols to leach more fully into the water and increases the contact between the piperine in the black pepper and the curcumin in the turmeric, which further enhances the bioavailability reaction. Drink it slowly, over 5 to 10 minutes, not rushed. Now I want to pause right here in this video and have a direct conversation with you about something I think is critically important. How long have you been living with joint pain? Not just the physical dimension of it, the ache when you wake up, the stiffness when you sit too long, the hesitation before you climb stairs, but the full weight of it, the things you have stopped doing, the plans you have quietly stopped making because you are no longer confident your body will cooperate. The way pain reshapes a person's world, gradually, almost invisibly, until one day they realize they are living a smaller life than they intended. I have sat across from thousands of patients in that exact place. And what I want you to know is that the body's inflammatory systems are far more responsive and far more reversible than most people believe. The despair that often accompanies chronic joint pain is not medically warranted. The research is genuinely encouraging. Tell me in the comments, where is your joint pain? Knees, hips, hands, lower back. Tell me your story because it shapes what I create next on the Dr. Ming Chen channel. And if this video is giving you something your doctor has never taken the time to explain, please give it a like right now. It is the fastest way. To help this reach the people who need it most, subscribe if you are not already subscribed. The next video in this inflammation series is going to address something that is happening in your gut that is directly amplifying your joint pain. And the connection will genuinely change the way you think about your entire body. Now let me talk about the 72-hour timeline and what to realistically expect. The claim that this drink produces measurable results within 3 days is not marketing language. It is grounded in the pharmacokinetics of the compounds involved. Ginger roles begin reducing COX-2 activity within hours of consumption. The inflammatory enzyme suppression is measurable in blood samples within 6 to 8 hours of a therapeutic dose. Curcumin, when properly absorbed through the piperine fat combination, shows measurable reductions in C-reactive protein and IL-6 within 48 hours in subjects with elevated baseline inflammation. Tart cherry anthocyanins reduce uric acid and tumor necrosis factor alpha within 24 to 48 hours of consistent dosing. 3 days is the window by which all 5 active mechanisms are operating simultaneously and producing cumulative overlapping anti-inflammatory effects. What most people experience by day 3 is a reduction in morning stiffness, specifically that first hour stiffness that is the hallmark of inflammatory joint disease. Joint pain during movement tends to improve more gradually over 1 to 3 weeks of consistent use. I need to be precise here about what 3 days means and what it does not mean. You will likely feel a meaningful reduction in stiffness and inflammation-driven pain within 72 hours of starting this protocol. You will not have reversed decades of structural joint damage in 3 days. Nobody and nothing can do that. What you will have done is begun to reduce the inflammatory load that is making that structural damage hurt as much as it does. The structural changes that come with continued use, the documented reduction in cartilage degradation biomarkers, the improved synovial fluid composition that has been shown in longer-term studies, those unfold over weeks and months. But the pain relief that comes from reducing active inflammation is genuinely rapid, and that rapid relief is what gives people the motivation to continue the longer protocol. My patient David, 67 years old, a retired contractor from Chicago, came to me with bilateral knee osteoarthritis so severe he had been told by an orthopedic surgeon that he was a candidate for bilateral knee replacement. He was taking 800 milligrams of ibuprofen 3 times a day just to function, a dose that was beginning to affect his kidney function, as reflected in his lab work. His wife had read about anti-inflammatory dietary approaches and asked me whether there was any merit to them. I designed a protocol for David that included this drink twice daily, once in the morning and once in the early afternoon, combined with some dietary modifications I will describe in a moment. At his 6-week follow-up, his WOMAC pain score had dropped by 38%. His ibuprofen use had reduced to 1 tablet on difficult days only. His kidney function markers had normalized. He told me he had walked 18 holes of golf the previous weekend for the first time in 4 years. His wife told me she had her husband back. David did not need a miracle. He needed the right information, applied consistently. Let me address the 2 most important variables that Determine whether this protocol works for you. Dosing and consistency. For dosing, this drink should be consumed twice daily for the first 2 weeks. Once in the morning, 30 minutes before or with breakfast, and once in the early afternoon. After 2 weeks, if your inflammation symptoms have meaningfully improved, you can maintain with a single daily morning dose. Twice daily is important in the initial period because the half-life of gingerols and curcumin in systemic circulation is relatively short, between 6 and 8 hours, meaning that once daily dosing in the first phase does not maintain therapeutic blood levels throughout the day. For consistency, I cannot overstate this point. 3 days is when you begin to feel results. 4 weeks is when the research shows durable structural level changes in inflammatory biomarkers. 3 months is the horizon at which the most significant long-term benefits, improved cartilage health markers, documented reduction in inflammatory gene expression, measurable improvement in synovial joint fluid composition become established. This is a protocol, not a one-time intervention. And the extraordinary thing is that a protocol that costs less than $2 per day and takes 4 minutes to prepare is well within almost everyone's reach. Let me give you one additional recommendation that the research strongly supports as a complement to the drink. The anti-inflammatory effect of this formulation is significantly enhanced when dietary omega-6 intake is reduced simultaneously. The modern Western diet has an omega-6 to omega-3 ratio of approximately 15:1. The anti-inflammatory target is 2:1. Omega-6 fatty acids, found primarily in refined seed oils like sunflower, corn, safflower, and soybean oil, are the primary dietary substrate for arachidonic acid, which is the raw material your body uses to manufacture prostaglandins, the very inflammatory compounds that ginger and turmeric are working to suppress. If you continue consuming large quantities of omega-6 oils while drinking this formulation, you are working against yourself. The single most impactful dietary change you can make in parallel to this protocol is replacing refined seed oils with olive oil, avocado oil, and butter for all cooking. This is not a deprivation. It is a substitution that costs nothing extra and removes the single largest dietary driver of chronic joint inflammation. Here is your complete action plan. Apply this starting tomorrow. Number 1. Gather your 5 ingredients this week: fresh ginger root, ground turmeric, freshly ground black pepper, unsweetened Montmorency tart cherry concentrate, and raw unfiltered honey. These are available at any health food store and increasingly at standard grocery stores. Total weekly cost for 2 daily servings will be approximately $10 to $14. Number 2, prepare your first drink tomorrow morning. Boil water, cool for 4 to 5 minutes. Combine all 5 ingredients in the proportions described. 2-inch ginger, 1 teaspoon turmeric, 1/4 teaspoon black pepper, 2 tablespoons tart cherry concentrate, 1 teaspoon raw honey, in 12 ounces of warm water. Add a small fat source. Steep for 3 minutes. Drink slowly. Number 3. Set a reminder for your afternoon second dose. Mid-afternoon, between 1 and 4 o'clock, prepare the same drink. Maintain this twice daily schedule for 14 days. Number 4. Replace at least 1 refined seed oil in your kitchen with extra virgin olive oil this week. Just 1 swap. Then another the following week. Number 5. Note your morning stiffness on a simple scale of 1 to 10, starting tomorrow. Track it for 14 days. The data will confirm what the research predicts, and having your own personal evidence of improvement is the most powerful motivator for long-term consistency. This is general medical information, and it is not intended to replace the personalized guidance of your physician. Before making changes to your health routine, particularly if you take blood thinners, have gallbladder disease, are being treated for any autoimmune condition, or are on medications that may interact with curcumin or ginger, please consult your doctor first. These compounds are food-based and generally very well tolerated, but your individual clinical situation matters. To this community, I want you to understand something about why I created the Dr. Ming Chen channel and why I continue to create it every week. There is an enormous amount of medical knowledge in this world that never makes it out of the journals and into the hands of the people who need it most, not because doctors are withholding it, but because the system does not give us time to share it. A 15-minute appointment is not enough time to explain what I have explained to you today. This channel exists to close that gap. If this video gave you something genuinely useful, a piece of clinical understanding that changes what you do tomorrow morning, please share it with someone you know who is living with joint pain. Leave a comment telling me where you are in your inflammation journey. Give this video a like and subscribe, because every week there is something new here that your doctor wants to tell you but has not had the time to. I will see you in the next one.